For cranial nerves, start with observation as per the other video. For cranial nerve 1, make sure that you have two different scents so that the patient's nostrils can be tested separately. First, cranial nerve 1, get the patient to close their eyes and identify the scent, and then change nostrils and identify the other scent. Onto cranial nerves 2, 3, 4, 6. Get the patient to read a newspaper at arm's length. If they're able to read that, their vision is fine. Make sure they're using the glasses that they already wear. Next, get them to follow your fingertips. Looking at the nail, make sure that your hand is halfway between you and them by starting out with your hand on their shoulder to measure distance, then do the H test. Next, testing for both accommodation and convergence, looking at the pupil size as well as the ability of the eyes to converge. Next, test the patient's visual fields. Get them to cup a hand over the eye, not block it, otherwise that might make the eye sticky and give you false results. Test all the quadrants using moving fingers. And again, repeat this with the other eye. Next, test the patient's blind spot using a red pin. Move it up and down to delineate the blind spot and make sure it isn't larger than it should be. Make sure that you're also covering your eye at the same time so that your blind spots will match. Again, making sure that the hand is cupped so as not to place pressure on the eyelid. Make sure that you are at the same eye level as the patient. Next, testing for consensual light reflex. First look at one pupil, then at the other to see if there's a consensual reflex, and then test the other eye, once again looking at both eyes to see if both pupils constrict. Next, we're testing cranial nerve 5, checking the muscles of mastication, and then gently with a piece of cotton wool, testing the dermatomes for sensory. Lastly, we'll check the jaw jerk. Place your fingers on the jaw and gently tap your own fingers. Next, we move on to cranial nerve 7 and check facial expressions. Ask the patient to mimic yours. If they're able to mimic your expressions, they should be fine. Place your finger under the nose when they blow out their cheeks. This will automatically check that no air is passing up through the soft palate. This automatically checked cranial nerve 10. Next, check the patient's hearing by rubbing your fingers together and moving them further away from the patient. The patient is asked to tell you when they can no longer hear the sound. Compare the two sides. If there is reduced hearing on one side, you may choose to do Rinne's or Weber's test. The order in which you do these is irrelevant as they're used as exclusion. Explain to the patient what you're going to do. using the longer of your tuning forks. Place it on the vertex or on the forehead of the patient. Make sure this is done in a quiet room, otherwise the patient won't hear it. For Rinne's test, agitate the tuning fork and place it on the patient's mastoid process. When they can no longer hear it, bring it to the ear and slowly move it away until they can no longer hear it. Repeat on both sides. Next, to test the vestibular apparatus, perform Hall-Pike's maneuver. Get the patient to look into your eyes as you drop them backwards so that the head is below the thorax, and watch for nystagmus. Make sure the patient is well supported. That was cranial nerve 8. Next, checking cranial nerve 9 and 10. Ask the patient to cough, check for a bovine sound. Using a tongue depressor, look inside the patient's mouth, ask them to say ah and look for any uvular deviation. Ask the patient to swallow, and if there was a problem there may also be a problem with speech. Next we test cranial nerve 11 using sternocleidomastoid. And there should be equal strength on both sides. You can also ask the patient to elevate their shoulders, checking trapezius. Lastly, cranial nerve 12. Get the patient to protrude their tongue. Is there any deviation, or any spasticity, or any fasciculation? Also push against the tongue as it's moved into the cheek to check strength.